Yeah.
we all in our minds think we're the best business person because we've established our businesses and we're doing well in what we do, but I want to get better.
We all do. I have consultants. I hire consultants. I hire business planners because sometimes, not sometimes, but you need somebody to check yourself and to like get an outsider's perspective looking in from sometimes, even when things are going well. I'll tell you, that's the best time to have a consultant in your office is because, okay, we're doing great. What do we have to do to stay here? Because complacency can kill. When you're feeling that safety and security, complacency kills. Welcome back to the All In, All On X podcast, where we take you behind the scenes of full arch dentistry, innovation, and the people who are redefining what's possible. Here we go beyond the procedures and into the lives of people shaping full arch dentistry. This isn't just about implants or workflows. It's about the lives we build, the decisions we make under pressure, and the leaders who push this profession forward when no one's watching. Get your head straight, because we're about to go all in. The All In, All On X pod is brought to you by JB Dental Labs, the elite lab trusted by full arch surgeons, prosthodontists, and digital forward practices internationally. JB specializes in precision full arch restorations, zirconia, PMMA, photogrammetry workflows, and fast turnaround times that don't sacrifice quality. JB delivers a truly digital workflow powered by their proprietary online portal for easy case uploads, real-time tracking, and fast, streamlined communication. If you're looking for a lab that understands immediate load, passive fit, and the demands of modern all-on-X dentistry, then JB Dental Lab is redefining what a full arch partner can be. Learn more at jbdentallab.com. Well, welcome back to the All In, All On X podcast. I'm your host, Dr. Adam Hogan, and I'm here with my good friend, Dr. Bill Anderson from Findlay, Ohio. Welcome.
Thank you,
Bill.
Appreciate you having me here. It's always a pleasure to come down here and visit your office and see how the master does it.
Thanks. So hopefully the master walks in the room one day or soon. I don't know. I'd like to meet him. But yeah, sort of impromptu podcast because you're here for the business course, how to 5, 10, 20 tomorrow. And also you're a leader with the American Academy of Implant Dentistry, the AAID. I want to thank you for that.
Thank you. I appreciate it. Come this September, I will be the president of the AAID.
Yeah.
So I'll hold that office for a year and hopefully we can continue to keep on the same beat that we've been going on.
Yeah, for sure. I mean, I'm a huge fan of the AAID. I think all listeners out there, anybody who's placing dental implants or interested in dental implants needs to be in the AAID. I think we should probably kick off and start on that.
Yes.
So we're going to talk about business. We're going to talk about the AAID. And this is a very, all my podcasts are unscripted, but this is very unscripted because just learned you were going to be here early for the course. I said, hey, let's do an in-person pod. And I want to talk about what the AAID has been up to. So
it worked out great for both of us.
Yeah.
As far as the AAID, we've actually had some good news here. Come up yesterday morning, we found out that the state of Ohio has now officially signed the legal documentation for us to be able to be notarized as specialists in the state of Ohio. So all the ABY diplomates out there, if you practice in Ohio, you are now, as of yesterday, considered a specialist.
That is crazy. Congratulations.
Yeah, thank you. It's been a long fight. We started back I did in 2016. I started on the dental board in Ohio. Was asked by the governor to be on the board. I had no idea why I was asked to be on the board, but you don't usually turn down a governor's request to be in a position like that. So I accepted the position. My very first day, the executive director just flat out asked, he said, what do you think should be the standard when it comes to specialty recognition? I had no clue this was coming out. I was blindsided by it. And right away, it set the tone on what the discussion was going to be that day. I flat out told them, I said, I've been with the American Academy of Implant Dentistry. I've been with them for, at the time, it was about 15, 16 years. That I had received my diplomate with them, and that I thought truly we were probably the forefront leaders when it come to doing implant dentistry, and that we should be recognized as a specialist. Well, needless to say, there was some hisses and boos in the crowd, all coming from some other dental specialists in the group.
Right.
And it went from there, and every month for 3 months or 3 years straight, every time we met, it was always about the same discussion about where it needed to go. So from 2016 to 2019, that's why I was on the board. We talked about it in 2018, the AAID filed litigation against Ohio State Dental Board, and 19, it got put on what they called a hold. And so when it was on a hold, any of us who were diplomates were allowed to go ahead and represent ourselves as such. We were allowed to go ahead and advertise as such, knowing that the state board would not put any type of litigation against us personally. So we advised every one of our diplomates to go ahead and do that, and all of us had. So we had a track record of 8 years showing that there was no harm ever done to the public, that our advertising followed the guidelines of what the state board required of us. And so with that track record, it got to the point that the circuit court said, hey, listen, you guys have been on hold for the last 8 years. We're going to go ahead and throw this case out, or you need to settle it. And so that's what it boiled down to. And finally, the state board, as of yesterday, came up with the scriptage and understanding that we now are going to be specialists here on out.
That's awesome news. Wonderful news. Finally, Ohio is on board. I know there's, I don't know exactly how many states are still off the board or not compliant.
We are almost at 25 states that are on board. So we're at that tipping point of where, you're either going to conform or we're going to come after you.
Yeah. So there's so much to talk about. So you're on the board. Congratulations, by the way, pushing that through. So that went through without a trial. They just agreed, right? Okay.
Correct. So we filed litigation in the circuit court of Ohio, and that court was going to go ahead.
2019.
Correct. 2019. Yeah. And we were going to go ahead and basically have litigation to however this was decided in court. The state board said, let's put this on hold. Let's, calm everything down. Everybody, let's just see how this plays out rather than go ahead and battle in court.
Right.
The truth is most state dental boards and most, when it comes to government funded boards, regardless if it's dental, medical, whatever, don't have the funding to do litigation.
Right.
And so they don't want to go that route. They don't want to be in the court system. They don't want to tie it up. They don't want funds that are earmarked for other things within their community to go ahead and be taken from them to battle something in court. And it looks bad on that governor that has that going on under his watch or her watch. Sorry. So a lot of times they don't want that to happen. And that's what happened in Ohio. So they pushed back and said, you guys go ahead, let's take a little step back and we'll go ahead and see how this works out. And so for 8 years, we were able to advertise as such. And not one complaint ever came from the public against any one of our diplomates.
It's beautiful. What a great test experiment too, a testament to the safety really of the advertising. Because I would think, okay, so you're on the board of dentistry, and there's obviously some people that are on the board that don't want this to be a certified bona fide credential. They don't want you to be able to tell anybody.
Still don't.
And they're protecting their own pockets and their own, because they've gone through the institutions of higher learning, and they think that that's the only way to gain any knowledge, and they want to protect their investment. They have the financial incentive to not let anybody else do it.
Yes.
Tell me about that. So when you're on the board and there's these specialists, okay, and I'm pretty sure we know what kind of specialists they are for the most part. And, what do you think is their main motivation? Is it just the protecting the institution, the patriarchy of the institution, that you have to go through these programs and nothing else will work? Right. There is no other good education. No one else is worthy. Or is it protecting their own financial interests?
It's a combination of both. Their biggest thing was always, well, you're not CODA approved. And CODA is something that is an arm extension of the ADA, which isn't even any longer called CODA. They've come up with a new organization, which is not even been around, I think, the last 2 years. And so there's other organizations that identify specialty groups that have been around longer than they have. So when it comes to it, it's always a piece of the pie. It's always, who's getting a cut and who's doing it. And basically in our conversations that I had, and it was an oral surgeon that was on the board at the same time I was. He and I, by the way, showed up at the board, both of us, our first day together at the same time.
Okay.
Neither one of us knew what was going on or why we were asked to be there. And they say, prior to walking in there, we were both friends. And on the way walking out that first day, sparks flew, and accusations were going on. And needless to say, I looked him right in the eye and I said, at the end of the day, it's all about patient care. And I said, I'm still going to be your friend. I'm still going to help you out. And I said, we're going to try to get this through. I said, I know you're never going to agree with me that this needs to be especially on our end, But at the end of the day, this is all about the patient care and not what we have going on.
Right. Right. So politics and people's own self-interests are at play here for sure. Kind of like what we would have expected to see on there. What was that like? I mean, on the board, is that how much work was that you had to put 3 years? I mean, how much were you away from your family, away from your practice? How much time did you have devoted to research and writings and meetings?
Ironically, when I was blindsided the day that I was in there, I mean, I was on my phone real quick, getting on Google and trying to figure things out and understand what direction they were trying to go with this. And surprisingly, even the AAID's attorney that was in there, he pulled me aside afterwards. He goes, "How'd you come up with that?" Because I pulled stuff out real quick, and I'm like, you guys, the ABDS, they're the ones who are backing us being specialists, and none of the board members have ever heard of ABDS.
Right.
And so when I put that out there, they were all like, "What are you talking about? There's another group out there besides the ADA that recognizes specialty." And I'm like, "Yeah." I said, "They've been around for 7-8 years already." And I said, "You guys should know this." I said, "Matter of fact," I said, "when it comes to anesthesia and facial aesthetics and, some of the pain management," I said, "those guys are all getting their notification. They're all getting recognized." And that's the group that started it.
Yeah.
And I said, and then the ADA figured they better get on board.
Yeah, well, I know a little bit about the history as well. I mean, I've been with the AAID for 20 some years now, and I think my first credential was in maybe 2007. Diplomate, I'm going to guess 2011. And, so I've been following this for a while. I got immediately after getting my diplomate, I was on committees and the admissions and credentialing committee. I was giving the exam for the associate fellow. Did you ever do that? Did you ever give the exam? Yeah. So you have, so I'm talking to the audience really now. So the audience should know that it is a extremely fair and systematic, statistically relevant testing protocol. That you not only have the written exam, you have to go sit oral boards, and no single examiner can pass or fail you. You have to sit at multiple stations, and the examiners are all weighted, and the examinees are all weighted against each other. So I think University of Chicago back then, Department of Statistics would run these validity tests to make sure that it was all fair.
Yes.
And so when we went to Supreme Courts, like before my day in Florida, or during, Texas or California, those big Supreme Court decisions, those exams hold up weight. It's not like one of these organizations where you can just pay $50 or $1,000 and you're certified.
No, it's definitely not a good old boys club.
No.
You better know your stuff going into that exam. You better know it for the written, and you better know it especially for the oral exam, because they'll find a soft spot on you and they're going to attack on it. It's like sharks of blood. They're coming at you.
Yes, they will, especially in pharmacology, Jim Rakowski. I'm not going to say any names, but it rhymes with Schmakowski.
Yes. Yes, it does.
No, Jim, you were very fair to me. I enjoyed all of my oral bisphosphonate questions. They were very good. I thought I did pretty well. I'm not a pharmacologist, but I thought I did pretty well. But they're bona fide exams. And then the other thing about it is, too, the AAID historically has been where a lot of specialists went for training on dental implants. I mean, especially if you went back to the late 80s and 90s.
So it's funny you say that, because now we're coming full circle back to my dental board discussion.
Okay.
So the oral surgeon that was on the board, he said, "You guys can't be the specialists." He goes, "There's no way. That's not possible. You don't have the training. You haven't had the proper vetting." I said, "No kidding."
The vetting?
I said, "Now,
the vetting.
Now, this particular oral surgeon, who is probably 15, 20 years older than I am. So I know in my mind, he was not taught that in dental school." I said, "Let me ask you." I said, "In your training, how many implants did you place in dental school while you were training for oral surgery?"
Right.
"Oh, that was different. We didn't teach it back then." I said, "Oh, kidding. Where'd you learn?" "Well, I took a course." I said, "The same courses I took?" So you're telling me I can't do implants because I don't know how to do them because I took them at a weekend course? I said, "Here's what I want to tell you about my weekend course. My weekend course was for a year long. It was every month for 10 months. I said, that was just one of the 4 courses I took. I said, I have over 1,200 hours prior to getting my diplomate status. I said, as of today, I said, I have almost 2,500 hours just in implants. I said, so you're telling me that I'm not certified to do this?
Right.
I haven't been properly vetted.
Right.
And he's like, "Oh, Noel, there's a few people like yourself, that probably could do this."
Just a few. A few.
I said, "Well, let me ask you." I said, since we're on the topic, of all the implants you placed since then, how many have you restored? I'm an oral surgeon. I don't restore.
Mhm.
I said, that's a problem. You're only doing half the job.
Right.
And everybody at the board meeting went silent. They all knew that I had an upper hand on him.
Right.
And he was, for lack of better words, pissed at me for saying that.
Yeah. So, timeout. I don't want to beat up on specialists out there because,
Exactly.
a lot of you guys are our friends. I mean, some of these oral surgeons really respect,
Absolutely.
super GPs that have done everything and they can, they
Yep.
do respect it. And then there are and most of them are probably older, the old guard who don't want to accept it because they think that if you didn't do it according to a certain program
Right.
that was established. So I don't want to beat up all oral surgeons out there.
Not at all.
Some of you guys are my friends and some of you support the Institute and me and what I'm doing. But you have a point, much to your point. When I was coming out of the Navy, I looked at going to perio residency, oral surgery residency, and I looked at this little practice right here we're in an extension of the original building behind me, little practice with Truman D. Baxter Jr. And Truman had been placing implants since 1972. Hilt Tatum has been in this building. He's been in this building with me. Like, they invented implants, and then they taught oral surgeons how to do them. And after 1987, when the Harvard study basically made it legal, but until 1987, it wasn't even legal to put them in hardly. Nobody recognized it. And then all of a sudden, people like Truman Baxter taught them how to do it. And I said, I can go perio, I can go oral surgery, I can go work with Truman. And I came to watch Truman one day and he did like 8 implants that day. And, he's probably doing 70, 80, 90 implants a month, right?
It's impressive. Yeah.
Yeah. And I'm like, perio resident, I call up a program. How many implants do you place in your program? They're like, somewhere between 35 and 80 or so is what they say they do. And then they'd all pull me aside and say, but it's hard to get implants. So when one guy does them, like 3 of us watch and we all sign off on
Yeah.
it. And I went, okay, in 2 or 3 years, I could place the same number of implants as this guy's doing in 1 month, so, and I had a baby. And so I thought, okay, let me just go this way. Anyway, the point isn't really to beat up on the residency programs. The point is to prove that, demonstrate that there's multimodal ways of learning. There's different avenues of the discipline. And as long as you're doing it well at a high standard and you took the time to learn it, I think that those other methods, should be recognized.
Yeah, I agree with you 100%.
Right?
Yeah, everybody has to learn their craft the way that they learn. Whether if you learn from reading, watching, or doing, I have to do all 3 in order to get it right.
Yeah.
I was one of those. I learned from Duke Heller. Duke was one of the greatest instructors I ever had. He would show you how to do it, and then he made you do the same thing on another patient. And so, to me, see one, do one. That was the way I learned in dental school. That's the way I learned how to do implants. And that's the way I've always taught, people who've come to learn from me. So that's, like you say, there's other ways of learning.
I think that goes, I think about it. I just had construction done in my house and it was a nightmare because this kid came in and he had a degree in construction management, a college degree, a 4-year college degree in construction management. Totally botched the job. It was going terrible. Like lawsuit botched job, level. And then, this other guy comes in on the job training, I don't even know if he had a high school degree, probably just a high school degree, but this guy was amazing. He'd like on the job training, he's sort of like that super GP guy, versus the guy that just came out of the higher learning program.
Right.
And the point is you can't, there's residencies, you can't learn everything in the residency. You got to get some on the ground training.
It's interesting you say that because, as of next week, I'm graduating from Jacksonville University. I'm getting my master's in science and implantology.
Congratulations.
Thank you. Dr. Rakowski, once again. It's interesting. For the last 2 years, we will have what's called roundtable, and we'll sit in class and we have Zoom meetings and everybody presents their cases and we'll go over things. And it never fails. Everybody picks on the old guy in class. Jim calls himself the old guy, but he's the instructor.
Right.
The instructor's supposed to be the old guy.
He's the sage. He's the Obi-Wan Kenobi.
Yeah. I'm not even Skywalker level. I'm just in there listening, and never fails the students say, Dr. Anderson, I know how the textbooks say you do it. This is what we've been told how we do it. How do you do it in the real world? I'm like, put that aside. They said, you have to think with your mind on what works best in your hands and how your patient needs to be treated. The textbook's going to tell you, it's going to give you an ideal way to do it. But your patients are all individuals, and you have to treat them individually to what works best on them. And so you can see the wheels clicking and everybody's like, oh yeah, now I understand. I said, it's no different than when you're in dental school. When's the last time you've done a textbook prep?
Mhm.
You know, textbook MOD. They're
Right.
not out there.
Yeah.
If you're doing it, it probably didn't need one.
I think I did one once. I don't know. Might have blacked out. But what does the patient want? And what's the best treatment for the patient? You know, just sitting in this room behind us, you know, Dr. Lish, she's a prosthodontist, works with me. He's an associate technically, but we're, you know, partners here.
Yeah.
And we had a patient back there for a comp exam after a consult, and, you know, we're sitting over the top of the patient. I think we should do this. I think we should do that. I think we should do this. And this could be done. And that could be done. And this could be done. And I was like, went in there 5 minutes later, I sat the chair up. I said to the patient, now, what did you hear and what makes sense to you? What do you want to have done?
Right.
You know, and it's like, because the textbook would say, well, that tooth should have a crown, and that tooth should have a crown landing thing with an endo, and that tooth should be extracted. And, you know, but what does the patient want, you know, and what should be done? There's a lot to be said for a little bit of that real world experience.
You know, you always treat the patient. And as I've been told, you know, and you've probably been told when you did your sedation training, that never treat a stranger.
Right.
You got to know them. You got to understand the patient. You have to understand their wants, their needs, and what their desires are.
Right. You know, I don't know, you may have heard me say, I've said it a lot on the pod too, and in training, but everybody is a friend. You never treat anybody you wouldn't call a friend, the same as you just said right there, because invariably something one day is going to be less than ideal. You're going to have a complication.
Right.
And if you have a complication on somebody that was never your friend, it is going to be a nightmare of a complication. And it could be litigious. It could be a board suit or case. I mean, it could be a lot. It could be a negative review, and they, you know, bad reviews all over town, but it's not going to go well unless it's a friend that says, hey, I understand. And you go, look, this happened. I'm going to fix it. I'm going to help you through this. Right. That's the big difference. So, I mean, so general practitioners can know what they're doing with dental implants. Is that your hypothesis? Is that your theory?
Yes, absolutely. 100%. You know, we all strive to care for our patients. That's the biggest and most important thing, of course. Your training, it doesn't matter where it comes from, in my opinion, as long as you're trained well. You need to understand your craft.
Right.
And that's what we are. We have a personal craft that we do, and we provide a service that nobody else can provide. Yeah. Unless somebody else who's been trained the same way we have.
Do you think that the treatment will be fair going forward in Ohio? Say a general practitioner has a complication versus an oral surgeon has a complication, and they both have a board case, similar board case. Do you think that it will be fair?
You know, I have sat on some of those cases where they've been in under the microscope for doing wrongdoing. And the biggest thing the board, when I say they want to know what you're training. Where did you receive it? So somebody who's an oral maxillofacial or a periodontist or a specialist of another type, they've had specialty training already through the school they're in. Okay. The general dentist, if they unfortunately taken just a weekend course, that's a problem. You know, if you just went in and say, hey, you know, you can go ahead and put a guide in there and place a couple of implants, you're great to go. And that's all the training you've had, you know, 16 hours over a weekend time. Not a good situation. But don't forget, we all have to start somewhere. Right. So pick the easy cases if you're just starting. Don't do these full mouth arches. Don't do these terminal dentitions, you know, things like that. You want to make sure you're doing the cases that are slam dunks, that you've got more bone than you need. Yeah.
I always say, you know, the lower premolar, you know, as long as it's far away from the nerve, the lower molar or the upper premolar, excuse me, you know, mandibular molar, maxillary premolar, you got straight vertical axes, abundant bone. That's where you want to start. I definitely don't think your first implant should be in a full arch. You know, there was a podcast that was bragging about the fact that they helped the dentist put in his very first implants on a full arch. This kind of goes back a couple of years, but I made a comment on Facebook. I didn't name anybody by names, but they called themselves out. They got really mad about it. And I thought, you know, it's just not fair, not just to the patient, but to that dentist, because that dentist doesn't know what he doesn't know.
You're setting him up for failure.
Maybe if it goes well, he's lucky, but if it doesn't go well, the board's going to ask.
Like anything else in life, you have to be lucky every time.
Do you want a stronger full arch foundation? Join myself, Dr. Adam Hogan, Dr. Brandon Koford, and Dr. Athena Goodarzi for Core Bootcamp Fundamentals with Cadaver Lab. Clinical surgical prosthetic training. Also, business training with hands-on sessions, live patient surgery, and a cadaver lab. Register today, theatlanticImplantinstitute.com.
Yeah. You've only got to be bad once.
Yeah,
and that'll cost you your license.
that's true.
So if you're bad once and you know what you're doing, you have the ability to dig yourself out of a hole.
Yeah.
You have the ability to fix it. Whereas if you caused nerve injury or something like that, you could be
Sure.
in big trouble. It'd be in one of your first cases.
Sure. Well, you know, when you're doing complications, first thing to do is own it, apologize for it, try to fix it, get them to hire help, whatever, do what you got to do.
Yeah.
But, you know, going back, you know, to getting treated fairly, I hope that in Ohio, now that you're a recognized specialty, I hope that if it does come to the board, that, you know, some kind of respect is given, you know, and I don't think it's easy to change the hearts and minds of people that are entrenched. You know, and I think back, you know, a couple of things that have happened in our local area over the past few years. You know, general dentist has an adverse reaction under sedation and loses license for a year. Oral surgeon has a death under sedation and gets a letter of reprimand. You know, and I mean, how do we come to terms with that?
So ironically, you just talked about a case we just had in Ohio, and this may or may not be something we want to put on your podcast, but let's talk about it. The oral surgeon that did the case used to be on the dental board at the same time I was. Not the same one I started one with, but this is the oral surgeon that I ended up finishing up my time with. He did a case, sedated the patient. Patient never woke up. The board didn't reprimand him. They took his license for life. He lost it forever.
Wow.
His sedation license. He can get his dental license back, but he will never be able to get his general anesthesia license.
I'd have to imagine the acts of omission or commission must have been gross.
Because like you said, you have to admit, you have to come forward and talk about what you did wrong. He tried covering up. He tried changing notes.
Okay.
Somebody who's been in his position knows better.
So now it's an integrity issue.
Yep.
So I can see where that would come. You know,
and I know him personally. Great guy.
Yeah.
Good quality work.
You know, the bottom line is we can all have adverse. I mean, even the best of dentists, oral surgeons, periodontists, we can all have bad, you know, cases come out. I mean, there was a dentist in North Carolina recently read the board complaint. He lost his license. I don't know for how long, but because of implants not integrating, an implant not integrating. I mean, that's not really that's just a fact of life sometimes. I mean, if you do enough implants, you're going to have some not integrating.
Absolutely.
Whenever I read a board complaint like that, I'm thinking there must be some politics behind the scene because the people on the board have had implants not integrating, right?
Yes. Yeah, absolutely. I mean, the statistics, I believe, is 5% implants don't integrate from day one. And so
that seems high to me.
It does seem high.
Yeah.
But because I think we have a lot more people placing them, that number's going up.
Okay. So now my practice, if I had a 5% failure rate, I'd fix it because you can't survive in business with a 1 out of 20 failure.
Correct.
That's a terrible number.
Because you have to place 3 more to fix that one. You pay for it.
Right. And then so do the 20 and another fails. So that's 6 now you're doing. Right. I don't think you could survive that long.
No, but because you have individuals or dentists who are placing that, you know, they're just trying to get the experience. They're trying to get it done. And they may be rushing the case or doing a case they shouldn't be, or case that has inappropriate bone, things like that, you know, whatever it may be.
Right.
So that number has gone up. You know, I think back, you know, Carl Misch used to always tell us, you know, initial integrity of an implant was 98%. That is more realistic probably in the time that we were taught, but now that's more closer to 5%.
Yeah, that's actually pretty scary. Need for more training. I mean, definitely a need for more training, which to me is scary because a lot of younger doctors think that they can take 1 weekend course and learn the rest on YouTube.
Yeah.
Have you, I mean, am I the only one that's been told that, or you feel the same way?
No, I had a colleague of mine that I worked with. Matter of fact, he went through a Maxi course, and everything that he learned outside of the Maxi course was from me directly. And I specifically told him, I said, listen, I said, if you go to court and you tell them this is what my colleague showed me how to do, you might as well open up your checkbook. I said, you can't just do the Maxi course.
Right.
You need to do other courses. You need to continue doing these courses. This isn't just a one and done situation. You know, this is a lifetime learning program.
Right. And you also have to be a doctor, and you have to be able to make the best judgment for that patient at that particular time. You can't just say so-and-so said to do this. When I do my clinical classes, I do joke because I was reading depositions. I was reviewing a legal case. I was reading depositions, and the dentist was asked, "Why'd you do it this way?" And he literally said, Michael Picos told me to do it that way. And Michael, much respect. Love you, man. Great. I've been to a few of your courses. And I thought to myself, for one, I'm sure Michael Picos did not have input on this case. And so I tell my people, I'm like, do not ever tell a jury or a lawyer that Dr. Hogan told you to do it this way.
No.
I said, you're going to come, you're going to learn my way of doing it, what works for me, but you have to make clinical judgments, and you should take probably 100 courses and put it all together into your own methods.
So just to take a step back on what you just said there, how far do you think it would go when you took your board exams if you said, well, Dr. Picos told me this is how we do it?
Right.
They're going to say, I'm sorry, you're the doctor.
Yeah.
Can you tell me again what you're going to do?
Yeah.
And God bless Mike Picos, because, I mean, he's a saint. He has taught thousands of us on how to do it.
Tens of thousands.
Absolutely. Yeah. One of my greatest instructors as well is him and Duke and Carl Misch. I mean, there's so many great guys out there that have taught us all how to do it. Right. But we sought them out. They didn't come to us.
Right. Yeah. I have examined doctors, and I'll say, why'd you do it this way? And they'll say, well, my mentor does it that way. Like, I need a better reason than that. I need to know, you have to, even if your mentor did it, I need to know why they did it. And you need to know that you understand that.
You need to know the reasoning behind it. It's not just, well, that's the way it's done.
Right. Well, it's sad on the attendance issue, and not, like the AAID, everyone's having lower attendance, because these doctors think they don't need to go to training. I mean, it's not just my classes or the AAID. Everyone's like, well, I can just go learn on YouTube. And I think that there's another danger behind that too, is that you don't develop friendships with mentors that can help you through difficult cases or get you out of trouble. Right. I will get, my phone's over here somewhere. I will get a text message every week from somebody that's in trouble, and I've never really met them or talked to them. And they've threatened to come to my classes for, a couple of years, but now they're in trouble.
Now they're your buddy.
And they want, how would you handle this? And I've been meaning to see you for a while. So, I mean, it's no doubt a intangible benefit to go to classes, go to the AAID in September, get mentors. The best education isn't even what happens on the main podium. And let's talk about the AAID now. The AAID is going to have great lectures. Hell, I'm going to be you should come listen to me. But the best education is the conversations that happen inside or outside the classroom, right? In the hallways, peer to peer, at dinner, at the bar, wherever. That's where you learn the most, and you're not going to get it on YouTube.
I can tell you, guys on the podium that have been on there, we're talking later on, just having a conversation, and you'll tell them about a way that you're doing something. They're like, I've never thought of that. Mm-hmm. That's incredible. I'm going to implement that into my practice. And you're right, because you're not going to get that off a YouTube video. No. You're not going to get that with conversation off somebody who's, done a podcast. I mean, you're not getting that element. And unfortunately, today's dentist, I mean, we had the COVID dentists who come out who literally had no hands-on training other than a mannequin.
Sure.
And now they're trying to figure out life and practice. But we also have a lot of these individuals who are coming out that are being hired by these DSOs. And the DSOs won't pay for them to go to, a $10,000 course, $20,000 course, whatever it may be. Right. Because they don't own their own practice, they can't invest in themselves. And that's where it's at. That's the problem that they have. They don't want to own memberships into whether it's the AAID or the ADA even. I mean, they do not want to have memberships because that's money out of their pocket that their corporation won't pay for. Yeah. So there's a lot of downfall that's coming because of corporate dentistry is literally quite ruining some of this.
No, I get that. But even on some level, they have to stop looking for the handout for someone else to pay for them. Right. I mean, don't get me started on handouts in the government, but dentists the same. They can't be looking for the handout. Oh, well, I signed up with XYZ DSO and they should be paying for this. Do you know how much money I got from other people to pay for all my continuing education? I mean, can I count the
let me count the zeros because they are all zeros.
Yeah.
Like there's no one at the beginning of any of those zeros. I mean, I paid for it all myself.
Trust me, if you had this conversation with my accountant, he would just shake his head and put his head down. He's just like, I don't even want to talk about it. The amount of money that I've invested in myself, it is a lot, but it's in my future. It's in my patient's care. And that's what I always focus on. All my care that I do is because I care for the patient. It's not because I'm trying to do this because makes a good living.
Yeah.
It does, but you got to do it right.
Oh, absolutely. I mean, I will take education. For the rest of my life, I've said this, for 20 some years, but the day you stop learning is the day you should retire and quit and give up, and because we see people and I'm in my 50s. You're in your 50s, I believe. I hope I don't let the cat out of the bag. Your wife knows that, right? Okay, so not that your wife's going to listen to you now. She hears you talk enough.
I know.
Did you hear my podcast? No.
Should be click.
I'm like, honey, I had a great podcast. Are you going to listen to it? She's like, why? I hear you talk all the time.
She's like, I work with you.
She works here. I see her at home. She's not going to listen to the podcast, so I can say whatever I want. But in case you are listening, I love you. Okay, so where was I at? Where was I?
Oh, we're at AAID and the meeting that we're having this September. It's going to be in Nashville. You guys talk about a great place to have a meeting, Nashville. I mean, it's an easy place for everybody across the country to get to.
Yeah.
September, great time of year. Weather's good.
Yeah.
We are going to have an event downtown on Broad Street.
Yep.
We are literally renting out the entire building.
I know.
We're going to have a live band. It's going to be just us.
Yeah.
I mean, you want to talk about camaraderie and getting together and talking to people and having fun and, maybe a little boot scooting.
So I'm going to be there. So I was on the committee that helped decide that.
All right.
I was there in Chicago a couple months ago, and we were like, what should we do for the, for the after party? And this idea came up of renting, I forget the name of the musician, but it's a 3-story bar. And, you're going to have food, you're going to have appetizers, they're going to be busing to and from.
That's the best part.
That's the best part. Yeah, don't drive. But it's going to be a heck of an event. This is, I believe, September 30th it starts through October 4th or something, or 3rd.
That's correct, yeah.
Okay.
It'll
You guys...
Wednesday to Sunday.
Wednesday to Sunday. You guys that are out there listening that are in dental implants, if you're not involved in an organization, you better get your butt involved in the AAID, especially if you're a general practitioner, because you're going to need the backing, the education, the credentials to back you up with whatever you're doing. And where better to go than Nashville, Tennessee?
Absolutely.
I mean, it's like Nash Vegas, baby. It's like,
I love it.
It's a great time. I mean,
if you don't have fun in Nashville, it's your own fault.
It's your own fault. There are there's Nashville and there's Las Vegas. And then, so years ago, I was on the committee that planned the national committee. This was like 2010 for a few years. And our best attendance would be Nashville or Las Vegas, and everything else was second.
Yeah.
Everything else was second.
Yes.
So this is a great time for you guys to get involved in the AAID. You're the incoming president.
Correct.
Right?
Yes.
That's awesome.
I'm the president-elect right now, and in September in Nashville, that's when they're going to go ahead and hand it over, and I'll take the reins from there.
You got any plans for, how you're going to decorate your Oval Office or anything like that? Are you going to have your Christmas decorations?
It's going to be bigly.
What's on your agenda for when you're president? What's the AAID up to this next year?
The biggest thing is obviously education. The AAID has always been about education. We want to make sure that's our forefront. That's our driving force to get people to understand, to learn the art, the craft.
Mm-hmm.
Beyond that is we want to go state by state, and we're knocking them down one right after another. We're doing that. As we said earlier, Ohio just became the last state to fall in line and to become one of the states to recognize implant dentistry as a specialty. We've got a couple other states on board. Your state, Virginia, is in the back wings. There's a hot topic there right now where nobody really knows how the board's going to handle it because they're wavering whether they're going to actually take actions on people who go ahead and say they're specialists or not. So
So there's a little history there. I don't mind sharing. Hope it doesn't get me in trouble. I don't know why it would really, but when I got my diplomate certificate, my credential, and I think it was 2011, give or take a year. I can't remember, 10, 12. It was, I started saying, okay, there's no policy on this. I'm going to put diplomate ABY. I put that little seal on all my advertising and my print advertising and whatever I was in. And I got turned in twice that year, once anonymously and once he was a specialist in about 30, 40 miles north of here, halfway to Richmond. And so I got this letter from the board that you're not authorized to advertise that you're a diplomate, or that these credentials, because it said fellow AAID diplomate ABOI. And they said, you're not allowed. So I called Frank Recker at the time.
Yeah.
So Frank was our champion attorney who won the Supreme Court decision in Florida, then Texas, then California.
Correct.
And Florida, Texas, and California all had to pay many millions of dollars back in legal fees, and they all lost the case.
Yep.
This segment is brought to you by JB Dental Lab, your go-to partner for full arch prosthetics, zirconia, PMMA, and digital workflow. With a proprietary portal, in-house designers, and an advanced education center, you will experience reliability, precision, and consistency. Visit jbdentallab.com.
And Frank, he was a friend of mine. I'd helped Frank on a few things. He helped me on a few things. And he said, just don't worry about a thing. I'm going to send them so many files and legal precedents. It's going to make their head spin. And then I'm going to tell them what California, Texas, and Florida had to pay us when they lost.
Yeah.
And so I just said, okay. Because I was shaking my boots. I was a lot younger back then. I was a lot more worried and fearful of, the powers that be. And so I was like, I don't know what's going to happen here. But I got a letter shortly after that said, basically, we're going to have this is going to be at an impasse, an indecision. We're not going to rule on this case. We're not going to sanction you. We're not going to fine you, whatever. But we're also not going to close the case.
Right.
Is what the letter said.
Just leave you hanging.
Just going to leave you hanging. I've been left hanging on that for about 15 years, I think.
Happens.
So, and I called Frank and he said, yeah, they don't want any part of this. They don't want any part of this. They don't want they know they're going to lose.
Yeah.
And so I might have still an open case up there in Richmond from 2011.
At this point, I wouldn't check on it.
Frank said, he goes, you just start advertising again.
Yeah.
They're not gonna come at you.
So this past year, Virginia rewrote their rules on advertising rules.
Okay.
And the way they basically wrote the rules is the way the stance Texas took after they lost their case.
Okay.
There are no rules. It's just open.
Right. That's what I understood. Yes.
And so we asked our attorney, and we just said, where are they at? Has anybody put in a phone call or asked them? And they have called directly. The AID's attorney said, listen, where are we at with this? And, if we have one of our diplomates advertised as such, where's your stance? They wouldn't answer. So
they never answer.
It's just a matter of at some point somebody's going to advertise. They're going to get turned in. We're going to find out what side they're on of this. And if they're going to be like Texas, we're going to be okay.
Right.
If they take a stance of, well, now you're in trouble, then we're going to go back to work.
Right. I don't think that they want any part of it. And, when you call and ask for guidance, this is one thing that really bothers me about the board and the front office is there have been times that I have called and said, hey, I want to make sure that I follow the letter of the law and I don't do anything against regulation. And I don't understand what this clause or paragraph means. Can you help me decipher it? And the answer is always no.
Yeah.
The answer is always you determine how you read that. And no, please, I'm looking for a little guidance. I want to know, do I need to do it this way or do I need to do it that way? Sorry, we can't comment.
Right.
Right. So it's like, are you there for me? Are you not there for me? Are you there against me?
Unfortunately, it's like, having a traffic cop explain, the rules and regulations on driving, they'll pull you over and give you a ticket for it, but they're not going to go through and tell you what you can and can't do unless it's a friend of yours that might be working for them.
Sure.
They just...
Yeah, but the speed limit is easy to understand. Some of this legal jargon, then these clauses and paragraphs can be a little different, particularly where it applies to sedation. Let's talk about that. Just the letter of the sedation words, the anesthesiologists argue over definitions of things like deep and moderate sedation.
Right.
Like there is no definition of it even in anesthesia programs.
Right.
No national consensus for sure. And yet they're going to define you can't do X deep, whatever moderate sedation, or you can. What does that mean? It doesn't have a definition.
Right. Ohio just rewrote their rules on sedation. and they gave it a really good definitive guidelines of what general sedation is, what deep sedation is, what moderate sedation is, and what twilight sedation or nitrous sedation is.
Right.
And those of us that were already licensed or certified, we have certificates, you had to basically reapply and put your information in on the number of cases you did. If you did not do that, you had to completely go back to school, take your 60 hours of didactics, do 20 sticks, and reapply, and then have somebody come in and recertify your office. I mean, they made it difficult. So there was a lot of people that unfortunately got caught not doing it because they just didn't know or didn't care.
Yeah.
And then when it come time to, go ahead and do sedation, they got in a little bit of trouble.
Yeah. Well, I mean, I fully support protection of the public. I mean, I don't want to come off as like anti-board, but I mean, at the same time, could you help out the people that you represent? Or I don't think that you're really there to, that's the problem is I don't feel like you're there to represent and help us. I think you're there to regulate us, like, the FBI or something. It's just,
it is a regulation and it's not an overreach, but what they want you to do, exactly what you asked before for guidance, they're going to tell you the same thing every time. Ask your attorney to clarify it.
Yeah.
Not us.
The problem with attorneys is, they don't
mind the gray area.
They love the gray area because they bill more hours for it. I mean, I was in the divorce of the century, and I once watched like 2 or 3 hours in a courtroom while my attorney and her attorney argued over what the word shall means. The word shall.
That's painful.
Does it mean you will do it? Or you should do it, or you will do it now, or you have to do it. I guess something like that.
You shall do it.
You shall do it. That and I'm like, I just paid this guy like $1,800 to talk about shall, and I'm watching, and the judge is asleep. It's like literally we had the oldest guy in the courtroom. He was asleep half the time.
He's been through it before.
Yeah, and I'm like, I'm falling asleep. It's like. They love the rhetoric. Yeah. They love the words. What does the word "the" mean? I mean, they'll go at it. And so that's kind of the problem, I think.
You're exactly right. When we went through some of the rules and regulations while I was sitting on the board, that's exactly what happened. There'd literally be one word and 2 or 3 people would start arguing over that word being in there. I'm like, you guys, we all understand what we're trying to convey here.
Right.
You know what we're saying.
Yeah.
They're like, no, we need to clarify that. I'm like, okay.
Yeah, I've sat in too many committee meetings, which is, I think I have PTSD, which is why I've been out of committees for a little while.
Speaking of which, I have to come up with some new ones. So if you're available, I would certainly like to push your name forward.
But we'll talk offline on this. Right. I'm happy to help the AAID in some capacity for sure. I'm already involved in 2, but yeah, I'd love to, help out more. I told everyone I would get involved more in these years. I was going to run for board of trustees. And gave it. Chitwood Walt wanted to go back, and he was getting some things done. I said, that was good.
Well, I certainly hope you reconsider and do it. We would love to have you on there. I mean, obviously, you've been a huge benefactor to implant dentistry and your teachings and helping people get to where they need to be to the level we're at. It's guys like you that need to be on the board for direction.
Well, I appreciate that. Thank you very much.
Thank you.
I don't want to let the AAID down. I mean, I'm definitely going to help out. I'm happy that I'm speaking for on the main podium. I'm really excited. I'll make an announcement here. It's Wednesday the 30th, the opening day. They got me at 5:00. So I want to make an announcement. I'm going to be teaching on a prosthetic surgical concept that really has not been published. And I found it through my own designs, and I've been doing it all on X for my first case was in 2003, by the way, in a residency, but I've been really hammering home all on X for well over, more than 10, 12, 14 years now. I can't remember, but I was my own lab tech. I was my own surgeon. I was prosthodontist, and there's things that I saw in smile design and bone anatomy that really stuck out to me that for the last 5 or 6 years, I just thought everybody knew. And then I realized that they don't. So I have this concept called the Vitruvian concept, and I'm going to be presenting this for the first time. And I think it might be a global first time at the AAID at 5 p.m. on Wednesday. And so if you're into full arch, and if you're just into full prosthetics, it doesn't have to be all on X.
Yeah.
It could be dentures or whatever. But if you're into smile design and anatomy and prosthetics, you don't want to miss it. So I'm excited that you guys got me there. Thank you for the opportunity to
Thank
do
you.
that.
Appreciate it.
I'm really excited about that.
Trust me, I'll be there front row and center.
Somebody out there's going to be some old guy be like, I knew this back in 1972. And I'll be like,
You stole my idea.
which probably is true, because I believe that on this earth, there are really no original ideas.
Yeah.
I mean, I think something's been done. Well, I mean, unless you're Elon Musk, you probably have an original idea. But for the masses of us, I mean, most of us, there's just, history just repeats itself. And, we spin off old ideas.
I agree.
Who knows?
Yeah.
But anyway, I'm excited about that. So Nashville, Tennessee, September 30th. You guys have to register. Be there. It's going to be quite an event. Nashville is always a lot of fun. And
I'm looking forward to it.
thank you for all your service too. Let's talk about, you're going to be president. Means you've already been on the executive board for 5 years.
Yes.
Right.
Yeah. I actually, while I was on the dental board, I had to resign from being on the AAID so I could sit in on executive committee meetings. And oddly enough, it just happened to be, I was home. It was 2019. I was done with the dental board. I was kicking back, and the AAID board meeting or annual meeting was going on. And I get a phone call from Suhail Mahdi. And Suhail calls me, Bill, what are you doing? I said, Suhail, I'm sitting in my recliner watching football. Michigan game's on. What do you want?
Uh-huh.
He goes, would you come back to the AAID? I said, Suhail, I'm always happy to help out my academy. I said, what do you need? He goes, we need you on the board.
Just a little, I got a little ask. I got a little favor.
I'm like, yeah, I was on the board of trustees. I'm like, all right. I said, so it's like the mob, you think you're out and they pull you right back in.
You're never out of the mob.
So welcome back.
Yeah. You want to be out of the mob?
Yeah.
I got a hole for
One
you.
way.
And there's only one way out of here,
So,
Yeah.
It was interesting how I got back involved with it, but I can honestly say it was Suhail Mahdi's phone call. He asked me, I'm like, I'm happy to do it. Come back in. And so I ended up being on the board of trustees and went all the way through the board of trustees back to where we're at now.
I know it's a lot. You've given of yourself for quite a lot of years to be the president of the AAID. I know that because I know what it's like. You got to do all your committee years, and then, you try to get to the regional offices, the regional secretary president, and then you're on the board of trustees. And it's not like this just fell in your lap. I know that this is 30 years of undertaking on your part.
Yeah, I've been a member of the AAID since 2005 when I did my MAXI course and my diplomate in 12. And it's just been a continuance ever since. Like I said, I took a short little break while I was on the dental board, but that was for particular reasons so we could be involved in discussions that were going on behind the scenes.
Yeah, and that's understandable. You can't have a conflict of interest, when you're on a state-run board, right? Beautiful. And then we'll wrap this. So you got the business class. We got the business class tomorrow. What are you looking to gain?
How to get the patient to say yes. We have patients that come in all the time and they see, this advertisements all on X or, some of these other large corporate groups that are advertising, which is great for us. It's free advertising, I feel like, because my patients come and ask me about it. But they get a little bit of sticker shock sometimes. So I want to create value to them. I want to make sure they understand what we're providing is a service that's not just temporary. This is something, if they take care of, is going to last them a long time.
Right.
Getting that patient to say yes sometimes is a matter of finding out ways that we can get them to pay for it. I'm not saying we're trying to manipulate that,
right? But
there's options out there, whether it's through financing or through its home loans or it's through their work process that they can have it done through insurance. I mean, there's ways we can help it to get there, to get across the finish line.
We're going to talk about all that. We're going to talk about a few things that may or may not surprise you that we're, because it doesn't just all begin and end with the patient saying yes. There's a lot of systems and teams that go into that. So that's where we're going to kick off tomorrow. I'm not going to give it all away on the pod, but I'm going to give you some hints about, I'm going to give you more than hints. I'm going to give you some direction on what you can do to make yourself different and where you can focus your energy and what doesn't work, where to stay away from, and what to be careful of. Because I mean, I've made all those mistakes.
Yeah.
Sometimes I'm surprised I'm still in business, because if I think about from when I really got heavier in full arch, probably 2014, was when I was really like, I mean, before that, I used to do full arch if it presented itself, right? But when I was really like advertising for it and looking for it. So it's been 12 years, I guess.
Right.
I mean, I can't believe by 2019 I was still in business, because I mean, I probably lost more money than I made. Like
the shotgun blast in the sky to see what falls, right?
Yeah, pretty much. Like, oh my God. So I'm going to talk to you about things that have worked for me, and I think will definitely work for you. But you've got the heck of a foundation, because you've got a really good general practice in Findlay, Ohio. You got another dentist working for you. You don't have to say your number over the air. I don't want you to, but it's not like you guys are struggling. You're not.
No.
You're just wanting to do a different kind of dentistry, a better way.
Correct.
Right.
Correct. I think you and I can both agree when you talk about the patient that comes in and they end up leaving because they can't do it. There's not a single one of those patients that doesn't come to us. There's a reason why they're already coming to us, because they know that they have a problem.
Right.
And the minute they walk in the door, they're a yes person until they find out what it entails.
Sure.
I've never had anybody tell me that they had the money and didn't want to do it.
Right.
So, we just have to find ways, whether it be for teaching purposes, and say, hey, listen, I can help you out, but you got to help me out.
Right.
I'm willing to work with you.
Yeah.
This is something that, didn't happen overnight, and I can't fix it overnight either.
Right.
But we're going to do everything we can to make you better.
Yeah. Yeah. It's all about, at the end of the day, taking care of people, and if they're making a valiant effort and can come up with something, there's something we can do for them. And it's, every doctor has their threshold on what they want to do other than full arch. It's a very dangerous game, especially for the young practitioner who comes out and says, if they don't do fixed immediate load full arches, they say the trademark all on X. I hate that term all on 4, by the way. Nobel, you can have it. It's fine. I don't like it because it trivializes, it demeans it. It makes it cheap. But it's fixed immediate load, full arch, right? And if for the young guys who say, I'm here because that's all I'm going to do. I just graduated dental school last year, 2 years, 5 years ago, and that's all I'm going to do. That could be very dangerous.
Yeah.
That's like putting all of your money in crypto, I'm going all in on crypto, and I hope that let it all ride on Black 18.
Right. Like you got 32 chances out there. You want that one? Okay.
Yeah. I'm going to put my entire life savings on Black 18 and see what happens. But you're already diversified, so you're in a good place. And I already know some things I'm going to talk to you about doing that you may or may not have already thought about.
Well, I'm looking for it, and that's why I came here, is because I know you are the master, as I said before. When it comes to business planning, I mean, I think we all can use a little help here and there.
Yeah.
We all in our minds think we're the best business person because we've established our businesses and we're doing well in what we do, but I want to get better.
We all do. I have consultants. I hire consultants. I hire business planners, because not sometimes, but you need somebody to check yourself and to get an outsider's perspective looking in from sometimes, even when things are going well. I'll tell you, that's the best time to have a consultant in your office, is because, okay, we're doing great. What do we have to do to stay here? Because complacency can kill. When you're feeling that safety and security, complacency kills. It's like, I live in a safe neighborhood, so I've been locking my door for the last 20 years, but nothing's happened around here for a while. I'll just start leaving the door unlocked. It's complete. That's an old counterterrorism.
Carl Misch always said, you don't know what you don't know.
Yeah.
And that's true to the point every time. Because if you are living in a tunnel and you're working in a tunnel, that's all you know. Until you look outside of it and you take the blinders off and see what else is out there, then oh, wow, situation happens.
Yeah. Last year, it's funny to say it, last year I went to a conference while everyone else was going to dental conferences. I went to a non-dental conference just to see what the world looked like from the outside, and what other people are doing. And it blew my mind. I brought home, it was a business conference. And I brought home so many great ideas that just aren't talked about in dentistry. It's like we are this, our gene pool in dentistry is a totem pole.
Yeah.
You know,
Straight up.
it's like, that's what they did before 10 years ago. That's what they did 50 years ago. That's what they did 100 years ago. That's how I'm going to do it.
Yeah.
And I went to a business conference that really had nothing to do with healthcare. And it blew my mind. And actually, opportunities kind of abounded. I was offered some different career paths, but I'm going to do this for a while. So, but you know, you got to step outside your comfort zone.
Absolutely. You know, we only get better by looking at other avenues. And if you're not looking outside of your single little area, you're just going to do that. You're never going to improve.
That's right. And the best way to improve is to go to the AAID on September 30th in Nashville, Tennessee.
That's right.
If you want to do that. Well, I think we kicked it around pretty good. Is there anything we missed?
No, I think we're ready for tomorrow.
We're ready for tomorrow. So, man, what did we cover? We covered it's legal to advertise your credentials in Ohio. We covered that. We covered how we're going to go after the other states. If they don't want to comply, they're just going to have to, right?
Yeah.
And you're going to be the president of the AID, and you're going to see this through. And I have no doubt in that. We covered, you've made a big commitment in your life to the AID, and we appreciate that very much. And by the way, I want to say again, this was not a beat down on any specialists out there. There are good ones and there are bad ones. There are good GPs. There are bad ones for sure. I mean, just like you can find good and bad janitors and school teachers.
That's right.
But so we're not trying to beat up any specialist, but there's definitely been a ongoing theme and a problem with certain individuals and mainstream national organizations and state boards that are holding back honest, hardworking people that want to do good service for their patients.
You know, just to make a valid point for you, one of my best friends back in Findlay is an oral surgeon. He was the first one to congratulate me.
That's great. Yeah. Yeah. And I have my practice back here runs 50% on referrals, of which I have a few oral surgeons who love what I do and they refer me patients, and a few periodontists as well, and even a couple of prosthodontists, and one who just says, you finish the pros because you can do it so much better and faster than I can.
Wow, that's great.
So, you know, there are specialists out there who do recognize, and I will be the first to say that I do make my mistakes, and I do redo my own work sometimes. You know, none of us is perfect.
We're all human.
But I think that that's important to admit that from time to time. But I mean, I've looked at my own cases sometimes and I'm like, someone comes in for, I'm like, hey, do you mind if I redo your teeth?
You're like, and why is that? You know, dentistry is the one area. Medicine is not like this, but dentistry is 100% this way. It's either broke or it's fixed.
Yeah.
There's no gray in between. It's either fixed or it's broke.
Yeah.
Medicine's like, here's a script. Let me know how that works.
What's your grading of health? On a scale of 0 to 10, how healthy do you feel? How well do you think your hypertension is going today?
Yeah. You know, you think we need that picture of the, you know, the smiley faces in the background? Ask our dental patients, where are you today on this one?
Yeah.
You know,
I don't need it. I walk in, I look at their eyes, and I know if the pros is right. I just walk in, I look at their eyes, and I talk to them for 30 seconds, and I know if I have to go to work or not. Is there more to be done? You can just see it all right there. Even if the patient says, it's fine, I like it. I'm like, no, it's not. Let me have a closer look. And you make a little adjustment, and then all of a sudden, like the stress goes away, and they're like, "Oh,
eyes light up." Yeah,
I'm like, see, I knew. I got to go to work. All right, well, it's been great. Let's let you get to dinner.
Thanks,
I got to get to dinner myself.
Appreciate it.
See you tomorrow morning, 7 a.m., 7:30. And we'll kick it off. We'll have a couple of good days.
Thank you.
For everybody out there, if you enjoyed this conversation, I want to ask you to subscribe on YouTube, subscribe on your pod app, subscribe on Spotify. Keep us in business. Keep us talking. We really appreciate that. Leave a comment. If you have any questions, you can search for Dr. Anderson here in Findlay, Ohio on the web. Ask him away, or AAID, you can get with him there as well. And you know where to find me here on the All in X Pod. Remember, if you're going to do anything, you need to go all in. If you're going to be committed, be good at it. So go all in, all on X. Thanks for watching. Until next time. Great.
Thank you.
I'm telling you, hey, if today's conversation resonated with you and you're looking to sharpen not just your technique, but your judgment, your discipline, and your long-term vision, then this is exactly why we built the Atlantic Implant Institute. This is not just some weekend course or module. This is not just some highlight reel. This is not just some collection of disconnected modules. This is the core continuum for education and full arch workflow. It begins with Module 1, Core Bootcamp Fundamentals, where we establish surgical foundations, diagnostic discipline, and repeatable decision-making under real-world pressure. And then it continues with Module 2, Advanced Prosthetics and Full Digital Workflow, where occlusion, vertical dimension, aesthetics, condyles, and execution all converge. And then we have Module 3, which tackles remote anchorage, pterygoids, zygomatics, complex anatomy, taught through biomechanics, planning for predictable outcomes. And after the continuum, we have modules in FP1, fixed immediate load, and also business, how to 5. This is business, leadership, and operational strategy so that you can build surgically what actually works in practical business. If you're ready to go into full arch dentistry with intention, structure, accountability, and purpose, you can learn more at theatlanticImplantInstitute.com.